Dr. Halliday, do you want to say
Sure,
a few
sure.
words about the general state of oral health and dentistry in Missouri as part of the rationale for why we're doing this?
Will do. Thanks, Dr. McManus. What happened in the United States from the late 1970s to the early 1990s, there were about 8 or 9 dental schools that closed down. There's a lot of pressure to close dental schools because the prevailing thought within the dental profession at that time was that there were too many dentists. Personally, I don't believe that was ever the case. There might have been a maldistribution where dentists were working, but I don't think this country ever had a glut of dentists, so to speak. But a number of dental schools closed down during that period of time from late 70s to the early 90s. And from the early 90s through 2003, there were not any new dental schools that opened in the United States. Well, what happened was we got to the point in this country where there were more dentists leaving full-time practice each year than were being graduating from dental schools. In fact, through about 5 years ago, the statistics were that there were 6,200 dentists per year leaving full-time practice, with only 4,600 dentists graduating from dental schools. You could do the math. You could see that after a while you're going to get a situation where you're going to have, over the decades, quite a few more dentists leaving full-time practice than are entering dentistry. To give you some of the highlights in the state of Missouri about access to care and the number of dental providers, the state of Missouri ranks almost at the bottom of all 50 states for the oral health status of citizens of the state. In fact, when the Pew Foundation gave a report card to each state on the status of oral health in the state, the average grade, it was graded on an A, B, C, D, F scale like schools, the average state from the Pew Foundation, the average state received a grade of a B. The state of Missouri received a substandard grade as a grade of a C. The federal government, the Health Resources and Services Administration, has done a survey in the state of Missouri and found that 101 of the 114 counties in the state of Missouri are designated now as being dental health professional shortage areas. Less than 11% of the dentists in the state of Missouri will treat Medicaid-eligible children. It goes on and on. There's just a huge amount of disparity in the oral health status of citizens in the state. A lot of folks have poor oral health conditions. The science and literature has very well proven that there's a strong association between oral health and overall health. Just for some quick examples, the chronic infections in the mouth, either from abscessed teeth or from gum disease, periodontal disease, will exacerbate diabetic conditions. It's also been linked to cardiovascular disease. Chronic infections in the mouth have also been linked to pulmonary disease, and also these chronic infections have been linked to low birth weight preterm babies. So a lot of folks tend to think, well, they're just teeth, what difference does it make? Well, quite frankly, the status of the oral health will impact a person's overall health. So the state of Missouri, not enough dentists, like I said before, 101 out of 114 counties are dental health professional shortage areas. The oral health status in the state has done a status survey, oral health status survey, and the oral health status is not good. There's a huge unmet need in the state of Missouri. As Dr. McManus mentioned, there is one dental school in Kansas City, and there's a dental school over in southern Illinois, but quite frankly, those two schools are just not enough to meet the needs within the state of Missouri. So the idea behind the school was we wanted to follow the tenets of A.T. Still University to treat underserved population groups and to raise the health status of the population to the highest possible level. The two schools I mentioned, great schools, but they just can't meet the need within the state. So there was a huge amount of interest within the state of Missouri. The Missouri Foundation for Health was very interested in seeing this new dental school open up. There's a lot of support from Jefferson City, and within the community of Kirksville, there's also a lot of support to implement this dental school. Now, Kirksville is a small town, and Kirksville itself doesn't have the population living in the area around Kirksville and northeastern Missouri to sustain the patient population needed for year after year after year of dental schools. The city of St. Louis, however, there's not a dental school here. There's a sizable population here. And St. Louis, quite frankly, has a dubious distinction of having very poor access rates to oral health for the general population. So the A.T. Still University looked at all the factors, number of dentists, distribution of dentists around the state, the need within the city of St. Louis, and the fact that St. Louis had the patient population that our students could help.